community. I hope you can hear me. Good morning, gut healing community. I hope you can hear me. Welcome. Big thank you to Megan and her family and the rest of the gut healing community allowing me to join you this morning and talk about eczema. So I love talking about these various topics, and I welcome any questions that you'd like to pop into the comments there. Eczema is an interesting topic because it really crosses over into a lot of different aspects. If you watch my previous video within this Facebook page on leaky gut or intestinal permeability, we've really got a crossover here because they're both similar and can interact and have inverse relationships. So yeah, so hopefully just wait a few minutes before we get into too much nitty gritty and really delve deep into this very important topic. So eczema is really, it's an abnormality that the immune system over responds to certain proteins that are part of the body. And normally the immune system just ignores these proteins and attacks only invading proteins such as bacteria and viruses. But in the case of eczema, the immune system loses the ability to tell the difference. So it's confused. Now, sometimes that's because the immune system is out of balance, and this is where it can get really tricky in resolving eczema. You've got to delve deeply into a differential diagnosis. Is this that the individual's immune system isn't operating well and it's out of balance? Is that where the focus needs to be for treatment? Or is it more that we're in a pro-inflammatory state, we've got digestive issues, here's our gut health again, and is that really the underlying issue? Now, I know many of you out there who are listening to this already know that there's a connection between gut health and immune system anyway, so you can see how there's an inverse relationship to that. And there's also a relationship between eczema and leaky gut. So think about that over response from the immune system playing in there. It's responding to everything and then it creates this particular symptom. Now the symptoms are awful. They range from just mild all the way through to absolutely horrific and everywhere in between. And the common symptoms, even if you do have a low level of eczema, it may be aggravated if, for instance, you've got exposure to cleaners and detergents that dry out the skin. So this is a bit of an issue in the current environment with those that have eczema on their hands and all this hand washing that we need to do with COVID. So there's that aspect of it. Also, things that we put on our body, like wool can irritate, synthetic fabrics can irritate, even fluctuations in our own body temperature. So at times where we have issues with body temperature, as in the case with menopause or even kids that run around a lot, sometimes that can be part of the issue. So as far as aggravating, but not necessarily as an underlying cause. There can be sudden drops in humidity that can aggravate because this reduces our moisture on the skin, and that can make the skin drier and more sensitive. Stress, it can aggravate everything, can't it? So that's an ongoing problem. Food allergies, this is really gut health related, immune system related. Some of us have individual food issues, and then depending on our gut health and our immune system, we can have certain foods that we're temporarily just over responding to, and I'm going to talk a little bit more about that. Animal dander can aggravate. Now here's an interesting one. upper respiratory infections can aggravate and contribute to this awful combination of uncomfortable symptoms. So if you're listening, drop in, pop a little comment there so I know you're here. If you've got any questions, please feel free to post your questions. So let's have a look at things that we need to look at and consider. So skincare. So it may sound a bit of an odd thing to suggest as skincare is a bit of an issue, but our skin can respond to pollutants and environmental toxicities. So, things like skincare, so makeup and personal care, we need to be aware of that. But also dust mites, grasses, things like that can affect us as well. Nutrition obviously plays a big part in our exposure to issues and sensitivities because we can have some nutritional deficits that contribute to us over responding, and especially when those deficiencies are related to inability to detoxify appropriately, so that can be an aggravator. And of course then we've got things like heavy metals that might be involved in your case. Certainly some heavy metals are common aggravators, so we need to be aware and be familiar with some of the common things in our biochemistry, that what I call having a close look under the hood to explore what might be an additional thing that might be aggravating us as far as skin is concerned. And in particular, today we're talking about eczema, but can affect our skin in lots of different ways. We've got to be careful about the pH of the skin. Now, there's a lot of discussion online about pH. Most of it's not quite right. So for healthy pH, we need good intestinal barrier. So not only in our intestines, but another barrier that we've got is our skin itself. So when we're thinking leaky gut, quite often these barriers, we've got a barrier in our brain, which if you've listened to my previous talk on intestinal permeability, difficult to get our tongue around. That's why we often call it leaky gut. So we've got lots of different barriers, and skin is a barrier. So the skin itself, the barrier can be, instead of having tight junction in the skin, it can be a bit loose. And you've heard me talk about this as far as gut health is concerned. So skin health is the same, and that's reliant on appropriate pH, it's reliant on appropriate nutrition, and is reliant on appropriate gut health. So, if we're considering investigating our eczema situation, one thing your practitioner may recommend might be helpful is to have an investigation into your nutritional levels. I highly recommend a hair tissue mineral analysis to do that. It's just really helpful to get a baseline, provides toxins, as well as nutritional deficits as well. So that could be really helpful in helping you guide your nutritional, your diet, and also let you know if you may be doing a great job with your diet, maybe absorption's not working in an optimal way for you. So these are things that a tissue mineral test can provide as far as information to move forward and help resolve your symptoms. But a microbiome test is going to provide information on whether you've got adequate beneficial bacteria to be able to help support your immune system. Remembering the great majority of eczema cases are about over-response of the immune system. Now, sometimes the immune system is over-responding for multiple reasons. If you've got a pathogen in your gut, in your microbiome, those little critters that live within us, and the immune system is like trying to attack it, but it's just overwhelmed, and then it's over-responding. I always think about the immune system and its over-response like when we get tired, we get a little bit irritable. We're quite often fatigued. One of our kids might not be, or our partner may not be responding appropriately to us. and we then over respond. And that's not healthy, is it? So our immune system sometimes can be like that. It's struggling, it's fatigued, it's got one more thing to handle that it shouldn't have to handle, and then it's over responding. So it's attacking self. It's self attacking self, just like if we attacked one of our family members verbally inappropriately. So it's dysfunctional. So the immune response is quite a complex activity and balance that a lot of people aren't aware of. So T helper cell responses that can be in balance are to do with Th2 dominance, which is common in eczema, or it can be Th1, especially with eczema, asthma are related, or it can be Th17. So as you can see by all these numbers, it's quite complex. Working that out is something that clinicians hopefully are trained well in and be able to put that picture together, what you are holistically and how to then respond. So eczema often comes as part of a complex health presentation. It very rarely is by itself, although from the patient's perspective, it often looks like it's the only thing, especially when it's very irritable. But naturopathic clinicians often can see a group of symptoms, and that helps them work out what that immune response is doing, and then prescribe appropriate herbs to help balance that immune response. Sometimes it's about calming the immune response, sometimes it's about balancing, sometimes it's about waking it up. And of course, looking at those foundational nutritional aspects that support the immune system. Is that why it's over responding? Is the immune system not managing well because it hasn't got the right foundational nutritional aspects? I'm just having a look around here and seeing how everybody's doing as far as checking in. Hi, Ashley. Nice to see you here. And please post any questions and any concerns, or, do you have a family member with eczema? We'd love to hear from you. And hi, Megan. Thanks very much for this lovely opportunity to be able to support the gut healing community and chat about yet another health issue that's related to gut healing. So yeah, great to be here as always. So let's talk about leaky gut. You can always pop back and have a look at my previous leaky gut video and how I talked about that intestinal permeability. Some of the things that are really helpful for both leaky gut and eczema as far as probiotics are concerned, there's a specific bacterial strain that is called, it's got a weird name, LGG rhamnosus. And it's actually very helpful for both eczema and leaky gut. So it's a generalized one. Now, certainly I always recommend with probiotics that you look at the microbiome. It's always better to individually prescribe probiotics. A lot of things have to be taken into consideration for best outcomes. But if you're doing a bit of self-treatment, that might be something that you might want to consider. If you're already on it, you may want to look at the dosing, monitor that. If you're not getting good response in reducing eczema being on that particular strain of bacteria, that's when you might want to decide to dig a little bit deeper. But generally speaking, that's a really healthy, helpful bacteria strain for eczema and leaky gut. So I thought that was really interesting that, a cure-all for both, you might say. Not always, but in most cases it can be really helpful. Of course, you want to look at also your diet and prebiotics that feed that particular bacteria and support beneficial bacteria. So that certainly, is something that you want to have a look at there. So we also want to look at supplements to tighten gut junctions. Now, this is about the leaky gut specifically, but those same bacteria that help, the same nutrients that help, are actually really helpful for skin junctions as well. So you'll hear me talk a lot of things today that you can actually apply to quite a few different skin issues. Yeah. So, having the right fatty acid component, making sure there's high levels of vitamin A in your diet. Of course, that you're absorbing all of these, zinc, vitamin D. These are some of the important nutrients and minerals that are very important for skin in general. So think about skin as we age, keeping it healthy, but also very specific for eczema. So we want to have them at the right dose. If possible, if the budget allows, you might want to check in and test some of those levels and make sure that you've got the right combination of levels there. Now, I mentioned earlier about some of the contributing drivers for eczema, and one of those is heavy metals. So a hair tissue mineral analysis can help identify those. Excuse me while I take a little sip of my tea. So detoxification, so liver support's really helpful. And something that we could all do with more of, especially as our digestion slows as we get older. So again, we come back to the diet. Have we got some lovely bitter herbs in the diet, in our salads, that are helping us as far as that's concerned? So you can see that, we're talking here about gut health, diet, detoxification, identifying heavy metals, any other pollutants. I did have a case last year of a beautiful woman. She was actually a practitioner that I was treating, and we tested. She was in a very polluted area of a major city, and we were having some resistance there with her health in general. So we tested some of the oxidative stress levels, and we discovered that she was actually really toxic. And then we discovered some of the industry that was around her home and things like that. And we said we've got to put some things in place to protect her. So it can be within your residential environment that you've been exposed to. It could be in your history, your health history, in your childhood, and you've not detoxified it as yet. But these are things, pollutants that we look at. Can be in the water, it can be in our food. Sometimes we, if we've got problems detoxifying in general, we actually want to be able to detoxify those things that have been accumulated. And some of us need to go 100% organic if our detoxification pathways aren't working well. So yeah, liver and kidney support, that may be a very important aspect of helping you resolve your eczema. And, this is where we start looking at individual cases. Not everybody needs that, but liver support in particular is very important when we're looking at eczema-like cases. But again, your practitioner can assess that, decide whether that's appropriate for you. When I'm treating eczema, commonly I'll put in just a general liver support supplement, and just make sure that that liver isn't having to chug along too heavily, just to give us a little bit of advantage there. Some people need high level liver support, so there's different levels that we can look at for each individual, but it can be a big part at times with skin issues. So something for you to keep in mind when you're moving forward, especially if you're looking at self-treatment. And of course, if you've got a practitioner that's helping you with this, check in with them and see what they think is appropriate level of liver and kidney support for you, and have, is it worthwhile investigating what your heavy metal toxic load is, all those sorts of things. So these are things that you can consider checking in on with your health and looking at whether they're involved with your particular case with eczema. Now, absorption. Absorption is a very interesting thing, because if we're not absorbing our food adequately, the immune system, which might already be a little bit overactive in an eczema case, may then have food particles that it's over responding to, and may spiral you into a further aggravation of your eczema. So when we're looking at digestive health, we've also got to look higher up, not just the microbiome, but higher up. And I always like to start in the mouth, making sure that we're stress-free when we sit down to eat, that we're chewing appropriately enough times. We're all very busy, so often we're talking and rushing around. Some of us stand up and eat or are working while we're eating. But when we've got a health issue such as eczema, we really need to look at those stress levels, and in particular while we're eating. So a good idea is just to slow that whole process down. Now, some people find it beneficial to look at including digestive enzymes and increasing stomach acid to ensure that we're breaking food down appropriately in the stomach, and also to minimize or avoid an over-response of the immune system if we've got food particles that are passing through those loose junctions, in our digestive tract and sparking off the immune system. Many of you have heard of me talking about, the old Lost in Space robot where he's going, warning Will Robinson, when an alien is approaching. Well, that's sort of how our immune response works. It's reading that we've got food particles, proteins that are foreign to it, and anything that isn't absorbed or digested appropriately can be viewed by the immune system as something that is foreign and therefore should be, attacked, and that may create a spiral internally of your immune system over attacking you, and that then can produce eczema. And it also can contribute to any other autoimmune condition that you may be experiencing, whether you know you've got it or not. Remembering this is all about an over response of the immune system, and sometimes the immune system is so fatigued and confused it actually can't tell the difference between you, food particles, bacteria and viruses. So these are ways of just helping the immune system along and removing some of those issues that might be aggravating your eczema today. Hi Sarah, nice of you to join us. Lovely to see people here and joining us. And remember, you might be watching this as a recording, which is fine because we've all got busy lives. If you're watching it as a recording, do feel free to comment even then. And I check in and keep an eye on this page, and Megan, the host of this page, also tags me if there's anything that you might require input on health-wise from me from a naturopathic perspective. So I'm here for you if you need, even after this actual live recording. Okay, so don't forget, if you are live, do post your questions. Happy to respond if I can. I'm not very good at doing things on the run, so if I do, forgive me if I need to get back to you with a more appropriate response, especially when I have my head really focused in on one aspect. Sometimes I need to take a step back and go, oh yes, this is the answer. So don't worry if I don't respond today. I will come back to you with a response. Just a quirky way that my brain works. We're all a bit different. So what is a helpful way that doesn't cost money, that can be helpful for calming eczema? So one thing is getting sun exposure. Now, not too much. We're not talking about burning, but getting some sun exposure, midday sun, and not to the point of even getting pink. So it only takes, depending on where you are in relation to the equator, sometimes it can be just a few moments. Now, sun exposure needs to be with your buttocks. Now, even if the eczema might be on your belly, on your arms, or some other place, don't worry. This is about sun exposure, the health-giving aspect of it, and also vitamin D. And so think about where you are in the equator. We're quite close to the equator here in Australia, and I'm in Queensland, so that's in the northern part of Australia, and it's quite hot. So I wouldn't be out in the sun very long, just a couple of minutes, buttocks exposed. So keep in mind, as far as privacy is concerned and all that, we don't want to scare the neighbours too much, but it is more beneficial to have the buttocks exposed. So you don't have to expose the part of the body that has the eczema. This is about sunlight, the correct UV light, and vitamin D, not just vitamin D. And of course, that's something we can do for free. So, and it's something you can do a few moments every day. Doesn't need to be long exposure, and certainly please be cautious. We don't want you to get any complaints from the neighbours, and we also don't want you to get burnt, because that is going to aggravate the permeability of your skin. So we don't want that. And also, please be careful about exposing eczema locally to the sun. Sometimes a little bit can be helpful, but for many it's not. So just be clear about that. And if you need further clarification about that, please post in the comments. Even if you're listening to this as a recording, I'm happy to follow that up for you. So let's talk about some topicals. One of the worst things that eczema produces is terrible, irritating itchiness. Yeah, this is when we just want to rip the skin off and we can't stop it. And it's really awful for little ones who really have trouble controlling that. Now, one thing that I do suggest, especially for kids that are, how will I say, they're sleeping, they're asleep, and even adults sometimes, they can't control the itchiness and they can't stop it. So cotton gloves are great for that sort of thing, just to create a barrier so they're not scratching it with their nails, of course. So keep that in mind. Works for adults as well, by the way, but I always think about little ones and the challenges they have. But how can we reduce the itchiness? Now, one thing as a naturopath and herbalist I find wonderful is chickweed. Now, this is something, I actually make it for my patients, so I put something in there to calm the immune system topically, plus the chickweed, and often I'll use some other things. It might be calendula, aloe vera gel, comfrey, things like that, depending on how the skin is going and how severe it is and what's going on for the individual. So I create bespoke creams for my patients. They're only available for my patients because they're prescription only. But you can get things like chickweed over the counter from your local herbalist, health food store, chemist, things like that. So keep that in mind as far as reducing that side of things, as far as that irritability, that itchiness. It's a terrible thing to experience. Now, if we've got infection localized because of the eczema, often I will use antibacterial herbs in that cream as well. But also we've got to look at what's going on systemically. So systemically means throughout the body. Now, remember earlier in this chat, and I talked about, our microbiome and what might be aggravating that immune system and imbalances there in the bacteria. So if there's an overgrowth in the gut of an opportunistic pathogen, it can be opportunistic and go from the gut health to a weak spot such as eczema and create an infection. So also what we've got is when the eczema locally, which might be on the hands, it might be on the face, wherever it is an opening in the the permeability of the skin, and that then is open to viruses and bacteria that we're all exposed to. So I like to keep an emollient type covering on eczema in the form of a cream that reduces the itchy aspect of it. Sometimes I use something like marshmallow. This is a really interesting one. You can use even teas for this. Make a tea for that you then strain, put in a spray bottle, and you can spray it on the location as well. So that can be quite helpful. And that could be something like marshmallow, which creates a nice coating. Now, I'm not talking about marshmallow, the something you buy at the shop to eat as a lolly. That's different. I'm talking about herbal medicine and herbal teas. So marshmallow tea that you can make a nice strong brew. Then you cool it, strain it, and put it in a spray bottle. Do keep it in the fridge because it won't have any shelf life things in there, to antioxidants, etc., to stop it going off. So do keep it in the fridge, and make it up fresh every few days so it doesn't go off. It is a real food, if you like. So that can help keep a little bit of a coating there, so things don't dry out, especially if you're in a dry climate. I'm in a bit of a humid climate here. I know in America, I think it's Arizona, is very dry. So depending, again, we're in a world climate here now. So everybody has a slightly different climate, slightly different levels of heat, humidity. So what I'm suggesting here really needs to be individualized for you, and created so it fits with your climate, what's going on, what the underlying driver is of the eczema, all those sorts of things. So keep that in mind when you're even trying any of these things and you're going, oh, this doesn't work as well as what Christine said. Well, maybe we need to look a little bit closer at your individual situation, which might have a climate aspect, a humidity aspect to it, but it also might be to do with your individual response with your immunity. It may be some personal care that we need to look at, but there's lots of things that we can do topically. Now, I know that Megan did a fermented foods online course for you, workshop, and here's something that you can do that's quite creative. You can use things like sauerkraut juice, yogurt topically. And I do know of a beautiful European woman who, when she was very young, she was recommended by her grandmother to use the liquid, the fluid from sauerkraut on her skin topically. And what she did was she strained off the liquid from her sauerkraut that she'd made, and she put that into a little bottle, stored it in the fridge separately, and actually patted it on the skin twice a day. And that resolved her eczema completely. Now, let's just talk about that for a minute. I did mention a particular strain of bacteria earlier in this chat that's helpful ingesting. So you can see that bacterial type foods, functional foods, we can actually use them not only to eat, and by the way, I did ask that particular person, did she eat the sauerkraut as well? And she did. So we can't decide whether it was just the topical worked or the combination. But I have used it with some of my patients that, I can't get product to them fast enough. They've got an exacerbation. They have to have some homemade sauerkraut. I have had them strain the solids and use it topically. And it has brought benefits, and of course then eating the solids as well. So something as simple as that can be really helpful. Now, don't go jumping in there, remembering everybody's a little bit different. Everybody's got a little bit of a combination of different things that might be driving the same diagnosis. So always try these topicals in a small way first. You don't want it to aggravate you, and you can do too much. There's a high level of vitamin C in sauerkraut, so it can have a little bit of an acidic aspect to it. And depending on your flare of your skin, and if it's open wounds, for instance, it can be a little bit painful. So go easy. Just try a little bit first on one little spot. Go, yeah, that's fine. Didn't aggravate, didn't make things worse, didn't hurt you, wasn't too strong, and then slowly increase until you find what's right for you and your level. Now, yogurt. Yogurt's an interesting one. Now, I'm not talking about, something that's got sugar in it, yogurt that's got fruit in it. I'm talking about homemade, good quality, plain old-fashioned yogurt. Now, you can use this like a face mask, yeah? So, because it is a little bit watery, yeah? But you can put it on like a face mask. A way of doing it so it's not so messy is do have, like, especially if you're using it on your face, is get like a headband and have it going under your chin around here so your hair's off your face. And you can put it on like a face mask so it does, if it does run down, it hits the headband and is absorbed by the headband. But you can place it on different parts of the body. It doesn't have to be about the face, because we do experience eczema all over the body. So think about that. Again, nice, easy home remedy. Again, we want you to be having appropriate ingestion of fermented foods if that's right for your microbiome. Too much might be too much for you, so be careful about that. Always good to have that checked out by a nutritionist or a naturopath. And of course, if you've got a microbiome test result, we can look at exactly what's going on. And some people are having way too many probiotic foods and creating another imbalance there. So I know that sounds a bit weird given what I've just said, but that's about individual health, and we've got to consider that. So yeah. Oh, Sarah asks, why the buttocks as far as sun exposure? Well, they're the aspect of our body that doesn't see the light of day very often, so you get better absorption. Most of us have a reasonable size space there. I know I do. So we're more likely to absorb. So if you can't do that and you're looking at some other part of your body, just look for the palest part and see if you can expose that to the sun. So, but ideally, it's about the buttocks. Pardon me, way too much talking today, tickling my throat. So do pop in any questions you've got there. I don't want to babble on for too long and bore you. I will be checking in on the questions for those that are listening to the recording. Pardon me. So just to recap, chickweed is helpful for itching. You can also do a herbal bath with oatmeal, good old-fashioned oats. Obviously, always check these things out first off to make sure that they're not an irritant for you. So don't take a lot of it on your skin. Pardon me. Also, rebalancing the gut and the immune system. So calming that immune system so you've not having that trigger all the time. And that commonly takes some intervention by your practitioner. I just want to touch base with some specific helpful supplements and nutrients. Vitamin D, so I always recommend checking on your vitamin D levels. Always helpful in times of viruses such as COVID. So check in on what your vitamin D level is. That can be a simple blood test and then getting that to an optimal level. Zinc, I also like to check in with that and make sure that we're not pushing our copper down, because there is a relationship between copper and zinc. So getting that level optimal for you, very important with skin issues, having optimal levels of zinc. Vitamin A, organ meats are fantastic for all skin issues and for the immune system. So you notice that there's a cross, if you like, relationship there. Vitamin A is excellent for skin, is also imperative for healthy immunity. Look at, in conjunction with your practitioner about what's going on with your immunity, especially if there's multiple things happening with your health case. Diet, have a look at those things that might be aggravating your immunity. And I'll just take a sidestep here with the diet. One thing that increasingly I'm seeing in a lot of skin cases, in particular eczema, is fructose. And some people have an issue with processing fructose. And some people, it's just within their genetics that that's an issue and their heritage. I had a case just a couple of months ago with a chap that had this chronic skin infection that he actually had forgotten to mention it because it was just ongoing most of his life. We did some common treatments that we'd expect it to be resolved, and it didn't get resolved. And because of some other things that were going on with his liver historically, it came across my thought process that maybe he's got a problem with fructose. So we tested, and he had a very high issue with fructose. Now, most people think fructose issues are related to fruit, and certainly fruit fructose is high in a lot of fruits, but not all. But a lot of foods have fructose in it, and it's really not even about the fructose necessarily. It's about the ratio of fructose to glucose ratio. So anything higher than 1 to 1 in its ratio from fructose to glucose, higher in fructose, can be a problem for those people that have a problem processing fructose. Now, what happens, and I'm going to tie this in with eczema as I bring this session to a close, is that fructose that can't be processed by the body's digestive system starts fermenting, and this builds like a little alcohol factory that we're creating in our body. It can create things like candida and contribute to eczema. It can also aggravate the immune system. If you've heard any of my talks or articles on ADHD, it's a real trigger for ADHD. One of the first things we look at with any children in the spectrum is how do they cope with fructose. So yeah, it's a big aggravator, but it also can play a role in eczema. So again, this is something that your nutritionist or your naturopath can evaluate for you. You can get tested for it. It's a simple breath test. Often I can just work it out looking at the diet and responses and things like that. So yeah, there's a few different pathways that you can go to get that worked out, but it may not be part of your health picture, but for some it is. So be aware of that in relation to diet. Yeah, and especially if you're doing a lot for your eczema and it's not working. So check in with your practitioner about that. Oils and fatty acids, including evening primrose oil, really helpful. So ingesting, having sources of it, it may be appropriate to have a treatment with supplementation, but also making sure that the digestion can break all of that down and you can absorb it. So another aspect to look at. So omega-3 is very important for as an anti-inflammatory, and of course for skin, healthy skin, and of course skin that we've got problems with, like with eczema. There is a relatively new product in the Australian market, which is an extract from fish oil called SPMs, and it's very good for chronic inflammation. Quite expensive, very helpful though, tiny little capsule, and I do prescribe it in some eczema cases or any chronic inflammation cases. So again, consider that, and happy to talk further on that particular one. What else have I got here in my lovely list of, top things to consider in this sort of picture, health picture? I've talked about some of the topicals, some really important ones there. I just want to go back to the oatmeal. So porridge, we're talking about oats now. Obviously, if you're reactive to them, you can't use them topically. But an old-fashioned way of doing this, you can do it in a bath, for instance. But you can also, whilst you're in the bath, is put the oats into something like a muslin cloth and tie it off, tie a bit of string around it so you've got a ball, and then, have that moist, and then just push that gently against the patches of eczema. And don't rinse that off, yeah? So that creates a barrier. Certainly don't use it if you already respond negatively to oats, that's for sure. Other things that can provide a protective coating, so this is protection of that area: shea butter, coconut oil, sunflower seed oil. There is a fantastic B12 cream that you might want to consider. Creams containing B3. Now, here's a really interesting one. So, often we look at B3 as well for skin issues and ingesting appropriate, fairly high levels of it, depending on the case. But also, there are quite a few creams that you can get with B3 in them as well. So just some ideas that are helpful with looking at some of these eczema cases. Eczema can be quite complex, so it's very rarely just like one-off thing and everybody can be treated with the same thing. So keep that in mind. If you've been doing some treatment, you may need to dig further if it's not resolving. Generally speaking, there's a gut aspect to it, so I'm really glad that Megan invited me to talk about eczema. So yeah, definitely consider checking in with your gut health, reviewing if it's worth it to actually test your gut microbiome. Is that going to help with resolving things, and what to do next? So I'll be popping in. I can see there's some questions there in the thread about how to spell some of these crazy things, crazy naturopathic and nutritional things that I'm talking about. So I'll put the spelling in there. But if you're listening to this as a recording, please post your questions. I'm sure Megan will tag me. Thank you for giving up your morning to visit with me and listen to me with this live video. I look forward to Megan's next invitation. I believe we're going to do some of these things on a regular basis. So I'm sure Megan will be looking at what you're asking for online, and we'll be then considering what's the most common thing and what everybody needs in our little community here. So have a great day, stay well, and I look forward to talking to you soon.